AM 1240 and 95.3 FM, WJON. This is Health Matters, brought to you by Rejuv Medical. My guest today is Brittney Braegelmann. Brittney is the physical therapy manager at Rejuv Medical. Brittney, thanks for joining me today.
Thanks for having me, Jay.
All right, so in the spring, a lot more people get outside doing spring sports, being active, but sometimes that leads to injuries. Tell me about some of the injuries that you see probably most prevalent that you have people coming in and having issues with.
Well, I think one of the sports that is starting and ramping up right now would be baseball and softball. And we oftentimes have kids come in, or even closer to summer when those slow pitch leagues are starting, adults coming in with shoulder pain and shoulder issues. They come in and they complain of like an achiness or not having power behind their throw, or even some numbness and tingling. And I think a lot of that has to do with doing too much too quick. You get excited, you're outside, you want to play, and then there's just too many repetitions performed in a short period of time, and the body can't handle it anymore.
Is there a way that you can build up strength, arm strength, shoulder strength so you don't get hurt?
There definitely is. There's an idea of what we call prehab, so pre-rehabilitation. And for my throwers, I actually have them start this prehab program usually in about February. So it takes a solid 6 to 8 weeks just to get stronger. So if you're waiting till the season starts to focus on these smaller rotator cuff and shoulder blade muscles that help stabilize that shoulder, if you're waiting till the season to start those type of exercises, doing that type of arm care program, it's too late.
So you got to start quite a bit in advance. So if people are listening to this right now, they probably should have already started.
Right. And exactly, they should have already started. Now, if you haven't started, it's not too late to start. And that's what I want to say is that you can't just perform your sport and expect a high repetition motion like the throwing motion is to go through a whole season or multiple seasons without having any issues unless you do something to try to prevent it.
Is there throwing incorrectly? A lot of times I remember seeing where people have their arm too far from their body, or maybe they're not using their legs enough when they're throwing, so they're putting too much strain on the arm. Are there ways where you can correct that type of throwing motion so they can minimize injuries?
There absolutely is ways to correct that. And what we do here at Rejuv Medical is we do a video throwing analysis, and we video you in slow motion and then take it frame by frame to kind of pick apart those mechanics to figure out why something is happening and then what we can do about it. So there are a lot of throwing drills that can be done based on little things that we see in that video to try to improve mechanics to help decrease risk for re-injury. And then kind of the extra plus is that if we make you a better thrower, you might even get some increased velocity out of those throws too, which is what a lot of people are looking for.
Oh, yeah, that's the big incentive. That's what they're looking for. How about shoulder injuries? Is there a type of throwing motion that's going to cause you to be more vulnerable to shoulder injuries as opposed to arm injuries?
I would say that there's a bunch of different mechanical flaws that we see that could put you at more risk for shoulder versus elbow. It just depends on the patient and on that thrower. And like you even alluded to the last question, the how they use their core and their lower body too. So you can't just strengthen your shoulder and your shoulder blade. You have to strengthen your core, your legs, and then work a lot on balance, which is even it's so important, especially in pitchers, to be able to find that balance point and safely explode from that.
You mentioned elbow, and one of the worst injuries to get if you're a pitcher, is the Tommy John surgery, the UCL injury. Where is that located in the by the way?
So the UCL connects your humerus, which is your arm bone, to your ulna, which is one of your forearm bones. And so if I have my arm straight out in front of me, palm up towards the ceiling, the UCL is on the inside. So that's the ligament that is closest to your body when your arm is down at your side. think of it almost being like the equivalent of the MCL in your knee or the inside ligament that helps stabilize those joints.
Why is that the ligament that tears often when people are pitching?
So when you're coming through the motion and you're bringing that arm up overhead, if there is a force to kind of, let's say, bend the elbow and stretch that UCL too much, it overstretches it. So think of just like an ankle sprain. Initially, it's just a sprain. It's a little inflammation. It's some wear and tear. But if you're performing this repetitive motion over and over and constantly stretching it, you can get one of two things. If you're younger and your growth plates haven't closed yet, you get what's called little leaguer's elbow. And that is where almost the ligament kind of pulls the growth plate open and irritates the growth plate. When your growth plates have closed, that's when you get these UCL sprains, tears, and ultimately, hopefully, never having to go the surgical route. But it can get to that point where the only answer is to do that because of the overload and the forces that UCL is trying to act against when that individual, when that athlete is throwing.
My guest today is physical therapy manager Brittney Braegelmann from Rejuv Medical. It's Health Matters in WJON. Back with more after this. AM 1240 and 95.3 FM WJON. It's Health Matters brought to you by Rejuv Medical. My guest today is physical therapy manager Brittney Braegelmann from Rejuv Medical. Talking about spring injuries. We touched on arm, shoulder injuries, elbow injuries. And we finished up by discussing the UCL and Tommy John injury certainly is a bad one that pitchers get, and that certainly could be a season ender. Usually it's at least a season. What is the normal recovery time if someone were to have surgery on the UCL and have to have that replaced?
So it's not necessarily replaced, it's reconstructed. So they're not putting necessarily an external component in. They're trying to suture that UCL back down to where we want it to be. But it can vary on the patient in terms of getting back into whether they're just a field position player, whether they're a pitcher, and then the components of, is there anything else going on in addition to the UCL? So if it's a UCL, or excuse me, an isolated UCL reconstruction, that can be completely different from having something else going on too. So it's not a great answer to your question, Jay, but it depends on the patient.
Right. I guess I thought that you don't take a ligament from a different part of the body and put it into that spot when you're doing the reconstruction?
So it depends again on the quality, or not the quality, the severity of the tear and what they're going to do. But similar to an ACL reconstruction is you can take a graft and try to repair it, and whether that comes from the patient's body or a cadaver graft or whatnot, it just depends on the surgeon.
So if someone were to have a tear in that ligament, do you feel it right away? And what is the difference between, say, a tear and a stretching?
So you will probably, if you tear your UCL, you're gonna feel it. There's no ifs, ands, and buts about it. Typically, it's an overuse injury, and it's kind of a snowball effect. So it may start out more as a sprain, and then the more repetitions that occur, the more injury that is inflicted upon that ligament, and the more tearing or the more severity of the tearing comes again with those increased repetitions.
I guess I'm not sure if you mentioned this to me, but I think it was somebody that I talked to, probably at Rejuv, in regards to ligaments, and mentioning that they're kind of like rubber bands. Is that something that you've ever mentioned?
It might have been me. I've used that
Okay.
analogy before,
Okay.
and how I describe kind of a ligament is a ligament, once you stretch it, it's stretched. It doesn't necessarily go back to its original length. Unlike a tendon or a muscle, those have contractile tissues, meaning that they can stretch and contract and stretch and contract. So oftentimes you get a lot of instability in a joint when that ligament has been overstretched. Now, granted, your body can try to heal itself as best as it can, but once it gets to that higher level sprain, then your body can't necessarily put it back to the original length to be able to stabilize that joint.
Let's touch on additional elbow injuries since you were bringing that up. What is the difference between a tennis elbow and a golf elbow?
So a tennis elbow is going to be more for the outside of your elbow, the lateral portion, and the golfer's elbow is going to be more for the medial side. And that's the same side as that UCL sits. But the difference between a UCL injury and either golfers or tennis elbow, golfers and tennis elbow injuries are from the muscles and the tendons around the elbow and overuse, not because of the ligament.
What is the treatment for that?
So there's a lot of different things you can do. Initially, you want to ice, you want to rest, even putting the wrist in a brace that doesn't allow motion to activate those muscles up at the elbow. If it becomes a chronic issue, there are a couple of things you can do. Always, being a PT, I'm biased, but there are certain exercises that you can do to help remodel those tendons and increase the blood flow and your own body's healing potential to improve that tendon quality.
Is there it's the repetition that's causing those injuries, right?
It is. So it's that for tennis, particularly like with a backhand, if you're going to extend or bend your wrist back, that's the motion that hits that muscle group that ends up being aggravated with tennis elbow.
So if you're going to try to minimize that, do you slow down your speed? Do you do it less? Do you have any suggestions as to how, if someone were to have golf or tennis elbow at some point in their life, how can they try to avoid getting it again?
So to keep up with any exercises, if they've seen a physical therapist, same sort of thing, that prehab concept is there are specific exercises that can help with that. In terms of slowing down a swing or whatnot, I think you just have to be very mindful of mechanics and try to keep your wrist in what's called neutral or as straight as possible and trying to avoid that overextending or overflexing repeatedly.
All right, my guest today is physical therapy manager Brittney Braegelmann from Rejuv Medical. Today, talking about common spring injuries. We got more to get to. That's coming up next here on WJON. AM 1240 and 95.3 FM, WJON. It's Health Matters, brought to you by Rejuv Medical. My guest today is physical therapy manager Brittney Braegelmann, Rejuv Medical. Today, talking about common spring injuries. Okay, so if you've got a tennis elbow or golf elbow, but there's also pickleball elbow, is that a thing?
And so a pickleball elbow would be similar to what tennis elbow would be. It's the same motion from extending back and bending your wrist backward repeatedly.
Okay, so you do see injuries where people are coming up with that same issue because of repetitions of playing pickleball.
Absolutely. And one of the other common injuries that I see in pickleball players is actually hamstring strains. So they're going down, they're trying to get a shot that's maybe, just 6 inches away from their racket or from their paddle, and they're overextending through that hamstring.
So how do you avoid those?
So similar, same sort of concept is that prehab is one. You want to make sure that your glute exercise, your glute muscles, so your gluteus maximus, your gluteus medius, that those muscles are nice and strong to help stabilize when you are trying to do those lateral or agility type movements. And then the other thing is to think about a warm up, and we haven't really touched on that at all yet, but you don't want to get out of your car, go onto the court, and just start playing. Your body does not respond well to doing that sort of activity. So what I typically recommend is you want to do an active warm-up, which means you're doing some sort of dynamic movement. It doesn't mean putting your foot up on a bench and stretching your hamstring. That's not enough. You got to maybe walk laps around the court, do some lunges, do some toe touches, something to get your body moving and the blood flowing to warm up those muscles and tendons. Then you can play and have decreased risk for injury. And then you do those static or those stationary stretches at the end of your activity.
If I guess what I'm thinking about here is with these types of injuries that people do get, if you're older, are you more susceptible to getting these injuries? If you're a young person, I remember many times never even thinking about stretching or doing any of that warm up that you're talking about, but now I would. Is there, once you get older, are you more vulnerable to these types of injuries?
Absolutely. As you get older, you are more susceptible for these overuse injuries. Number one, your body's ability to heal itself isn't as good as you age compared to when you're young. Your body isn't able to have as much blood flow to those areas. Your body isn't able to send all the right type of cells to help with healing. It's just the nature of it. And then once you are injured, it takes longer for your body to heal the older you are.
Does it matter how much muscle mass you have?
I think it would matter that you have the muscle mass in the right areas, if that makes sense. So yeah, you could have big, strong bicep muscles, but if you don't have a strong rotator cuff or those shoulder blade muscles to act as the core for your arm, then you are going to be more susceptible to the golfer's elbow and the tennis elbow. Just like if you hurt your low back, you strengthen your core. So for the upper body, so everything from the wrist to the shoulder, you need to strengthen the core of your upper body, which includes those rotator cuff, which are deep, deep, deep stabilizing muscles in your shoulder, and then your shoulder blade muscles, which act as that stable base for the entire arm to move upon.
How important is it to have good flexibility?
Flexibility is always good, especially when you are trying to do certain activities like pickleball. And like I talked about, that shot that's just about 6 inches away, and you're going to have to overexert. If your muscle length is limited to a certain length, you're going to pull that hamstring a lot easier than someone who has a little bit more flexibility. Now, having said that, there is such a thing as too much flexibility. There are people who have hypermobile joints, and you need to be that much stronger to stabilize those joints in order to protect yourself from injury.
Is there certain activities that you could do to improve your flexibility?
So I think yoga is a great example, an activity that you can do to try to not only strengthen, but specifically strengthen through targeted muscle, or excuse me, stretch through specific targeted muscle groups. And then just knowing the areas in your own body that where you do feel like you carry more tightness and trying to remain consistent with that. So going to one yoga class a week is fantastic, but that's not going to carry over and change and lead to changes in tissue length. You have to be doing stuff one, if not twice a day, to really make long-term stretching and flexibility gains.
If you're overweight, are you more vulnerable to injury?
That weight puts more impact through your joints, so you are more at risk to have um, degeneration and wear and tear through your joints.
Does it matter what your diet is as to, whether or not you get injured?
So a clean, healthy eating and anti-inflammatory diet will make sure that your body can respond to these micro tears, to these smaller overuse injuries. And if you have a lot of unhealthy things in your diet, your body almost has to figure out how to digest those, and you're not putting your body in the optimal healing potential that eating clean or like an anti-inflammatory diet would help you with.
My guest today is physical therapy manager Brittney Braegelmann of Rejuv Medical. This is Health Matters on WJON. Back with more after this. AM 1240 and 95.3 FM WJON. This is Health Matters brought to you by Rejuv Medical. My guest today, Brittney Braegelmann, physical therapy manager at Rejuv Medical. All right, Brittney, a lot of people out doing running, especially with the weather being nicer. How important is it to run correctly, and is there certain footwear you must have if you're going to maximize your ability to run and not get hurt?
So running mechanics is another thing that we look at here at Rejuve Medical, and we take that video in slow motion and frame by frame and try to break it down. Now, most of the people that come see me, they come see me because something hurts. So yeah, we take a look at their mechanics, but I also want to just pause and take a moment and say that if you're not in pain, I don't know if I would change your mechanics. So I would kind of let you run through some stuff until something starts to break down, and then let's look at your mechanics. If you look at high level runners, some of them have impeccable form and you strive to look like those runners. And then sometimes you still notice some of these things that you're like, I think that doesn't look quite right, or you're trying to figure it out as a PT mind at least. But like I said, is I have people come here that are in pain with something. So certainly that is one aspect that we look after. And in regards to footwear, yes, it is important that you are running in the right type of footwear. And there are hundreds, if not thousands, of options for people's feet. And there is not one perfect shoe for everybody. So it'll depend on your arch structure, whether you're flat-footed, whether you have a high arch. It'll depend on how you run. If your heel hits the ground first, if you run more on your toes, it's just something that you're going to want to talk through either with your physical therapist or a shoe specialist and someone that really, really is informed of all those things I kind of touched on.
If you run flat-footed, is that a bad thing?
So if you run flat-footed and you're not correcting the arch kind of being pancaked down, that can influence a ton of things up the leg or up the chain. And it'll influence not only the foot, but the knee and the hip and then the back. So you want to make sure that everything is in proper alignment when you're running. Similar to what I talked about throwing, is that this is a repetitious, everything over and over and over. And if you're constantly putting strain through those joints the incorrect way, then something will break down.
If you are experiencing like shin splints, for instance, when you're out running, what is that an example of?
So shin splints is another overuse injury where the muscles that attach to your shin bone almost tend to pull away and irritate a little bit. Now, shin splints could, the tough thing with shin splints is they could also be, like say you went to your primary doctor, they say, oh, you have shin splints, just ice them. But you could also be having something called medial tibial stress syndrome. And that means more that you could have a stress reaction or a stress fracture happening through your tibia. And so you want to make sure not to belittle anything like that and just chalk it up as shin splints, when in fact you could be experiencing something worse, and trying to run through that could lead to a fracture.
Is there such thing as being injury prone?
Sure, there's some people that genetics just kind of put you where it's at, in terms of maybe you have some anatomy that is not in perfect alignment. Maybe you have a calcium deficiency that you didn't know of that's going to put you at higher risk for like those stress reaction and fractures. Maybe you have that hypermobility, like I mentioned, is your ligaments just aren't as supportive as other people's, and you didn't know that. So your joints are having excessive mobility, which is going to wear down the joint over time. So there's lots of things there. And then injury prone, not only those genetic type things, but if you don't have proper control of your limbs. So say when you're jumping or running, your knee, you don't even know that your knee collapses in every time, because the way that your brain communicates to your muscles, or we might want to say some people are uncoordinated or they're just not using their muscles the right way. Those are people that, because of the way they move, may put them at a higher risk for injury.
Is there a certain way to fall to avoid injury? And can you train someone to do that?
You can. That's why, you practice falling and you practice diving for volleyball and you practice that for baseball and softball. But our first instinct as humans is to put our arm out, right? We want to brace it with our hand, but then that can put us at a risk for a wrist fracture or an elbow fracture. So almost that term tuck and roll if you can per se, you might land on your shoulder, but hopefully not enough impact to do anything. And that takes a little bit of that coordination in practice to be able to do that correctly.
Brittney, if people are listening to this and they're thinking that this could be beneficial to them, especially some of the suggestions you had about the warm-ups and how to try to condition yourself so you can avoid injury, how can they contact you at Rejuv?
So they can call us at our front desk at 320-217-8480, and they can ask to speak with the physical therapy department, and one of us can talk with them. They can schedule an evaluation to see us in person to really get an idea of what's going on.
Brittney, thank you.
You're welcome, Jay. Thank you.
That's Brittney Braegelmann, Physical Therapy Manager, Rejuv Medical. This has been Health Matters and WJON, brought to you by Rejuv. We return next week at this time.